I'm just going to record this session as well, and I have unmuted you all, so you may ask me any questions whatsoever you would feel like, so that you can feel at ease and you can feel comfortable with your English speaking as well. If you would have any doubt, you can ask me anything. Please feel free to ask anything, whatever you would like. So you can
Sir,
unmute yourself. Yes, please.
good afternoon. Sir, how much emphasis is given to the pronunciation part during the speaking in OET?
Ma'am, see, there are a lot of different accents, and your examiner can be different, and especially who assess your speaking is different. That person mostly is from Australia, so accent will not matter too much. Pronunciation, yes, of course, it matters, but again, there are very few pronunciation things that might be wrong because most of the time pronunciation is up to the mark. If I am saying can, I would always say can, like the words I have spoken in this particular speaking, which we have just recorded back would be the same. I don't think so. There is any variation in pronunciation we do. Like, if you have any example, you can ask me and I can let you know. Like, suppose if I will give you one of the examples. If you say asthma, so that is not a problem because in India we say asthma, but otherwise the normal pronunciation of this word is asthma. So you should better say asthma. But if we say asthma, so people do not fail you for this thing. So that's fine because we are using it this way. But yes, of course, it is our responsibility to improve. There must be some marks deduction, but it can't fail you. Matlab, they can't fail you for this thing if there is a single word that is being used wrong. If there is any specific disease that comes in your role play, so you can ask the examiner before the commencement of speaking, how do we pronounce this disease, so he would be able to help you. But ask in front, otherwise you would be in trouble. So most of the times the diseases are very common, like hypertension, diabetes, anorexia nervosa. It can be other poisonous things. There can be anything, of course, spondylitis, but there is nothing that changes with pronunciation. Most of there are a couple of things. If I say eczema is also the same. There is one disease I don't remember. At psoriasis, you might speak wrong. The people who don't know that psoriasis, there should be a p in the there is a p in the front, but that should be silent. So it's so psoriasis, but that we can understand. This is again the rules of English. When we say psychology, any p before s is silent. Psychology. So this word psychosomatic, whatever the word those start with psyche, so the P is always silent when it comes with S. That's why psoriasis is also silent. But you can ask me, you can give me example if you have specific example to ask, man.
Sir, once I was objected by someone that the word is not prospective, it's perspective, according
Yeah,
to your
there
perspective.
is difference between the two words, ma'am. Prospects होते हैं. What are your future prospects? What will you do in the future? Perspective is a different thing. What is your nazariya? Perspective means what is your perception. So these are two different words. Of course, he will say you that this is wrong. So there is no word as prospective. That is about your future prospects. What are you looking forward to? Perspective and perceptions are kind of your nazariya. Like, what is your perception? What is your perspective about this thing? So of course he will mind it.
Right, sir. Thank you, sir.
Of course, ma'am. Most welcome. Any other question, please, by anyone? Anything by anyone, please. Please ask anything. Don't go for the recording. Nobody knows that आप बोल रहे हो या कोई और बोल रहा है. आप अपने क्वेश्चन हिंदी या पंजाबी में पूछो. But again, please try and speak in English if you can. But you must rather talk in English when you are about to take your exam. So जो भी है कहीं से तो शुरू करना ही है ना हमें. We should start it from somewhere. So please, if you have any doubts, कुछ भी पूछो. मतलब कैसा भी. Anything that you might remember, anyone, please.
Hello. Sir, there was one more thing.
Hmm.
Sir, since obviously English is not our sir, am I audible, sir?
Absolutely.
So, since English is not our native language, this is a problem in my case. While speaking, if at all by chance there is one single word that by mistake we utter in Hindi, like yesterday what I did, I said theek hai. So what if happen, what will happen, it will they will obviously deduct marks, but
Ma'am,
how can I
ma'am, as far as I feel, they won't even deduct marks even. It's by chance, and it just come, okay, that's all right. That's okay. I will again say, okay, that's okay, not a problem at all. So tell me about this thing. So it will not matter, to be honest. Something that happened, kind of by chance. So it will not be. They will not be deducting any marks. Don't worry.
sir, so what we can do is, can we immediately apologize
No,
or
no, 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 no. Don't do into that. That is
keep
a
it,
bad part. So it's a
just
ठीक है
ignore?
I mean, that's all right. You don't have to worry about anything. Of course, I am here to help you, and nothing to worry about this thing because it disturbs the whole. That is what people do wrong.
Right,
And
sir.
Renuka, ma'am, you speak. I can't tell you. See, that is what is the problem with humans. You are a brilliant girl, but you are striving for your exam. But at the same time, there are other people who are listening to you एंड दे मस्ट बी थिंकिंग अरे यार इतनी अच्छी इंग्लिश बोलने वाले को भी अपने ऊपर डाउट है तो हमारा क्या होगा मतलब व्हाट आई वांट टू से that that the people having good english should take responsibility and should have less fear. Of course we want to work hard, of course we want to pass, of course we do have anxieties, but still the people who are good they need to be little more sorted. They should understand अगर छोटा सा निकल गया उसको अपोलोजाइज करने की क्या जरूरत है मतलब वो रिकॉर्डिंग को खराब कर देता है. So it's better to say I mean this and this thing and you don't have to worry about this thing and you just continue on with your medications. And also it is very important for you, Mr. Williams, to I will try to rather improve myself more. That is what I require my extra English for. That is why I want to practice more, so that if there is something that wrong happens I should be able to make it up with my other sentences. So that is why I want to say. And please, Renuka ma'am, I don't doubt anything in case of your English unless you do something really patchy or kind of you make a blunder. Otherwise you're going to pass anyhow in English in speaking. So you don't have to worry about that. Rather it's just about you need to be more confident. So go sorted, just be at your light mood, and it's very important to feel light. And especially when the exam is done, the reading, listening and writing, first is listening followed by reading followed by writing. Then people what they do, they start discussing about their reading, right, listening and writing. That is where the major flaw is. Flow means kami, FLAW, flow. That is where the major flow is. That if you don't discuss this thing, rather you concentrate upon your English sentences and just sit down and relax yourself, it is much better. But that is what is the problem with the kids. They start discussing even before they take their speaking. So just chill out. Don't discuss with each other. There's no point of discussion when the paper is already gone. We can't change it. So I don't encourage discussions after the exam. It's just the exam that you can take positively, and that is the only thing you have at your hands.
Right, sir. Thank
तो
you so
प्लीज
much.
डोंट मतलब आपका ऐसा क्वेश्चन पूछना मतलब आप पूछो मतलब रेणुका मैम ऑफ कोर्स देयर इज नथिंग टू वरी, योर क्वेश्चन इज नॉट रॉन्ग, बट आप मतलब हमें बहुत 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 ज्यादा मेहनत करनी चाहिए. अगेन मैंने आपको पहले ही बोला था, व्हेन गुड पीपल थिंक ओनली अबाउट देयर सेल्व्स, दैट इज वेयर सोसाइटी गेट्स डिस्टर्ब्ड, because good people should be able to do something good for others too. So it is very very important to be strong enough. So and that is what our responsibility is. If God has given us English for a particular, ऐसा नहीं है कि आप इंग्लिश में अच्छे हो, people can be good in other things. I'm not saying, I'm not grading people, I'm grading a particular a skill with a particular exam. So that is how I'm saying you good. You can be good at, you can be bad at managing life, maybe they are good at managing life. You can be bad at something else, they can be good at something else. So every person, every human is unique in his own way or in her own way, and everybody should be respected. Because if somebody does not know English, it doesn't mean that he's not a great human being. He must be great human being, because every human being anyhow is great. So you need to find out good things about yourself, and we need to work hard on those things where we are bad at. So it's just about practice. Practice is something that makes us good in any skill. So we do have responsibility in terms of OET and speaking English, and we should ask more. And of course मतलब जिनकी इंग्लिश इस लेवल पे नहीं है, डोंट वरी, इतनी नहीं चाहिए, टेक इट इजी. बस अच्छा बोलना है, मेन बात है आप टॉपिक कैसे बोलते हो. क्वेश्चन तो आपको इंग्लिश देखनी नहीं, आपको तो ये बोलना है, do you exercise daily? Okay, how many times in a week? All right, do you smoke? How many cigarettes do you smoke? Okay, do you drink? How much do you drink? That I have already told you in the last video, which would be uploaded as well along with this video. So it would be very nearby. So you would be able to relate these things. One of the students is asking, is it right? We will ask how long you have been having this. Yeah, but it's better to like how long have you been having this? Have should be before you, before subject when it is a question sentence. It's a question mark sentence, so called interrogative sentence. So in this case, it will say, how long have you been having this problem? Again, it is simple to say, when did it start? Oh, is it the first time you are experiencing it? Okay, have you experienced this thing in the past as well? All right, okay, no. So this is the first time. So you can ask these things. Of course, we do have. Again, it will not happen if you listen to this recording one time. Again, I'm telling you, it should be a habit. If I have recorded 3 videos only of speaking, just make it a habit. Before you sleep, listen to all the 3 videos before you sleep every day, even for 30 days. How does it matter if it improves you? That is what is the problem with the humans. They say, oh, that's enough, I'm tired of listening to the same thing. See, every great person in this world ever is great because they have done the same thing so many times that they are that great. Like a musician keeps on playing music, AR Rahman keeps on doing same thing, Sachin Tendulkar keeps on playing with his bat. This is what repetition does. This makes you champion. This is what is the secret of champions. They don't get tired and bored of doing the same things all over again. We do. We do have problems. We are middle class people. There is nothing wrong with repetition. Just repeat, repeat, repeat. Talk in English. If you are tired of repeating, don't do OET. Talk normal English at home. It will not. It will help you not to get tired, but to get your work done in a better way. You would be more smooth, more fluent. So it will make you feel better.
Excuse me, sir.
Yes, please, ma'am.
Sir, I want to ask one question. Sir, is it compulsory where we can use only that information which give us into the speaking task, or we can use additional knowledge from our side?
Simon, ma'am, the task over there is gonna be bigger.
Okay, sir.
So you already will be having enough information. What happens if examiner says, you say something like that, okay, so now it has been given your task hydrotherapy, recommend hydrotherapy and physiotherapy. So you know now you would be requiring few bit of physiotherapy and hydrotherapy sessions, and you would be absolutely fine, Mr. John. Okay, but what is hydrotherapy, nurse? Now you are stuck. You don't know what is hydrotherapy. So you say, see, for this, we will fix your appointment with the physiotherapist. He will certainly explain you everything about physiotherapy and hydrotherapy and what kind of sessions you might be requiring. So I'm just going to fix your appointment with the physiotherapist if you will allow me. Is that fine with you? Yeah, nurse, you can book my appointment. Okay, that's fine. Then I am fixing your appointment with the physiotherapist and he will explain you everything about these problems. So you have spoken 2 more lines, showing more of your English and still not taking any chance. Don't take it as an IAS exam where he's asking you questions to check your knowledge.
Okay, sir.
Yeah. So we don't have to take any chance. So anything that you do not know and the kind of comes on you, so don't worry, doctor will come. I'm just telling the doctor to come. I'm just recording your vitals at the moment. Once I record all these vitals, I would be giving this information to the doctor, and he will better assess you, will prescribe you the medication as per your problem. So don't worry, it's gonna happen. It's going to happen soon. So for the time being, I need to carry on with my vitals. So could you please tell me, like, for so now I need to record your vitals. So I need to check your blood pressure. May I? So you just carry on with your flow. You don't have to get disturbed. Sometimes examiner can be very reluctant. Sometimes he can be very invasive. So you have to take care of both the things. You need to practice both the things. That is why I say your English should be spot on. You should be in very good practice of your English, and then if examiner does something this or that, you should be ready for that. You can't say examiner can't do this, examiner can't do that. It's not his exam, it's yours, man. We need to work hard for our goals. We need to be ready for the same. People will always have problem, ma'am. Similar, what should I say to everyone rather, ki when we are in India, we always think let's come on student visa, and over there we will talk in English. Then people come here, they meet more Punjabi friends here, they start even talking Punjabi even more. So that is what is the problem. I'm not saying there is anything wrong in talking in Punjabi, but we should be very good at a skill we are coming to the country in. Then we can speak Punjabi by our choice if we want to with our mates. But so as to feel comfortable in the country, it's very important to have a good grip of this language so that you can enjoy the culture more. So it's just about those things. So that is what I feel, and that is what I say. If you're getting a chance, and today you all guys, you don't have to work too much because you are in India. If you are not working, I'm sorry. If you're working in India at the moment, it's disastrous. I know you hardly have time for yourself. But for the time being, if I say positively, if you're not working anywhere, then this is the best time. Why would anybody think of even coming to the student visa? Even if somebody fails in OET for 5 times, even then there is no point of coming to student visa, even in the terms of finances and even in the terms of hard work. Because over here, if somebody gets stuck in the student visa, that means you will have to be a student, you will have to work 20 hours a week, and you will have to manage your home by yourself. There is no maids, there are nothing, you need to do your work by yourself. At the same time, you would be doing OET, and you would be thinking of your work permit. If you can take that much of pain, why don't take this pain now in India? Take this pain now, it's easier. So that is what is the whole point. Like, it's not about 1 2 3 4 5 10 times. I don't care. I care, of course. It's not in that way, but I care more for your passing and changing your life. That is what my intentions are. That at the end of the day, everybody who is taking coaching from Dr. BKM should be at the place where he or she wanted to be. And there is no use of giving up. No use of giving up. If you have think about something, work hard, come here. If you don't like it, after some time, work, learn work culture, and go back and serve your country again. But for the time being, if you have a chance to come, please utilize this chance and learn something new. So please, the major thing I want to say is, don't look out for, I don't have any person to talk with, sir. यार, आई कांट टेल यू, मतलब मेरे को इंग्लिश सिखाई है, मैं बचपन में इंग्लिश मीडियम में पढ़ा हूँ, पर हमने कभी इंग्लिश बोली थोड़ी. वी नेवर टॉक्ड इन इंग्लिश. आई नेवर हैड अ फ्रेंड. आई हैड नो वन टू टॉक इन इंग्लिश एवर. अभी भी मेरे से कोई बात नहीं करता, मेरे दोस्त मेरे से इंग्लिश में बात थोड़ी करते हैं. Nobody does. It's just about my practice with myself. I have done it alone because I wanted to be. I wanted to learn. I want to learn. I wanted to learn at that point of time as well when I was learning English. It slowly and slowly it has become fluent, and now I can see myself whenever I talk to anyone, I find myself more fluent, better than ever, because it keeps on improving. It doesn't stop anywhere. It becomes better and better with every passing day. So that is how it is. We have to work hard wherever we are, any day. मैंने आपको बताया ना, every single sentence you have said will take you towards your goal. Every single step, even the milestone as bigger as Arnold Schwarzenegger taking 7 to 9 times Olympiad. I don't know exactly, but he says it's every single rep that matters. जब मैं थक जाता हूँ, बस एक repetition और अपने आप को यही समझाता हूँ, बस one repetition more. That is what we need to do यार. हमें तो उतनी मेहनत भी नहीं करनी है. हमें उससे कम, बहुत कम करनी है. So कहने का मतलब यही है कि we have a chance at our hands, and we should not get distracted by any negative feelings, because this is the cheapest thing that is happening ever for the nursing part ever. कभी भी किसी ने फ्री में नहीं बुलाया, कभी भी नहीं. So this is like the best thing. You should try harder. Any other question that you would like to take? Is it good? So I'm just gonna stop the recording for now, and I'm gonna upload all 3 videos for you all. Today we will try to hold the reading for the day so that you can listen to these speaking videos for like 5 times maybe. But please finish up your speaking today only and start speaking from today only for your exam, whether you have after 2 days, after 10 days, after 20, 30, because speaking is the one that will give you to give you the confidence to take the exam. At the end of the day, every person judges himself or herself on the basis of the speaking he has improved or she has improved in. If the speaking improves, then everybody thinks that I can take the exam. If speaking does not improve, everybody feels like, no, I'm not up to the mark, I don't deserve to take the exam even now. Speaking is the first thing that will give you the confidence to fill your exam and to go ahead. So please talk in English. There is no other way. Whether you are living with 10 people who speak Punjabi, take your time out or talk to yourself in English. टॉक टू योरसेल्फ, रीड इन इंग्लिश, मतलब कोई भी आधा घंटा लगता है, 1 घंटा लगता है, पढ़ो. जब स्पीकिंग मतलब जब वो रीडिंग कर रहे हो, रीडिंग में थक गए, 4 क्वेश्चन किए आज रीडिंग में, तो कहा है आपको रीडिंग में कम क्वेश्चन करो, 5 क्वेश्चन करो, 6 क्वेश्चन करो. व्हेन यू आर टायर्ड ऑफ रीडिंग आफ्टर डूइंग 5-6 क्वेश्चन और वो सारे ठीक किए आपने, एक्स्ट्रा टाइम लेके, टाइम ज्यादा लिया लेकिन ठीक किए सारे, उसके बाद ना उसी रीडिंग पैराग्राफ को पढ़ने लग जाओ, बोल के पढ़ो कि this reading is done for this and this purpose. Mr. वो published an examination, published a paper, research paper on this particular, जो भी लिखा है वहाँ पे उसको बोल के पढ़ने लग जाओ. बस उठने से पहले एक बार वो पैराग्राफ बोल लो, आपकी इंग्लिश स्मूथ होने लग जाएगी. There are many ways out. Think about the ways. When you will think positive, you will find the ways out. Right, so I'm stopping the recording. This is again Dr. Bhupesh from Dr. BKM Institutes. I'm going to upload these 3 speakings today, and please listen to it so that we can march forward with a lot more positivity. And tomorrow we will do double the times the reading, and we will focus on the writing and reading part tomorrow. Again, we have done speaking after a long time, but we'll upload all these 3 videos. But I assure if anybody listens to these recordings for like 5 times and then 3 times or maybe 2 times every day, they will feel much better, and 100% the speaking component will improve. There is no point that the speaking component will not improve. But you have to understand, you have to listen to all these 3 videos. That is how it will happen, because the first will give you that initiation that you have to listen to it 4-5 times, and the second one is the most important for your OET part. The third one is to stay motivated and to to do the best whatever you can from your side. At least try your best from your side so that you don't regret on the later stages of life that I did not try my best. Every human in a way should try his or her best when the time is in the hands. So that is what is the point. Rest, I'm switching it off the video at the moment, and then again we will talk a little after switching off the recording as well. And that's from my side for the moment.